Hello everyone, this is Sandeep Sharma here. So I'm back with my part 2 video. In this video, I'll be talking about the paper pattern of AIIMS, PGI and JIPMER. What are the latest trends based upon the last exam which was held, and where should you focus while studying? Because limited time is there, you can't read everything. So let's begin. First of all, we'll talk about the AIIMS exam. What is the paper pattern? Now, AIIMS exam pattern has changed significantly since last few years because approximately there are 200 questions to be solved in 3 hours. I'm saying 200 approximate because new type of questions are now being asked in AIIMS entrance. Out of these 200 questions, visuals are 35 to 50. So almost one third to one fourth paper is visuals. So from where the visuals are usually asked. The type of visuals, there are histopathology slides. Surgical instruments are asked in surgery, obs, gynae and orthopedics. ECG pictures are asked in medicine. Syndrome pictures are asked. Types of rash is given. Hand, foot, mouth disease rash and zinc deficiency rash, measles rash, chicken pox rash. They are the usual things which are asked as visuals, have been asked, likely to be asked. Clinical signs in medicine, surgery, gynae, peds and orthopedics, like you will have a child lying down or an adult lying down, a sign is being performed and they would ask what sign is it? Is it Kernick sign, Brzezinski sign or some new sign? In orthopedics, you may have that anterior draw test, posterior draw test, Lachman test being done, and they will ask if this test is positive, what is the likely diagnosis? And radiological images, obviously, and culture media, parasite eggs, photographs of these can be asked, and you may ask questions related to them. So, particularly pathology and medicine, as well as surgical instruments, these are the areas from where maximum visuals are asked. So, when you are preparing, these are the points where you should be focusing upon. PGI AIIMS exam also has videos. Around 3 to 8 videos are asked on an average. They are mainly clinical videos. And all the 3 papers where videos have been asked, at least one, sometimes 2 videos have been asked from pediatrics. Like they gave a photograph of a child lying down and the child was having seizures and they asked the type of seizures. So you should know what exactly tonic, clonic, myoclonic terms mean. Similarly, last time there was a question where they had put a sick child and they asked the Silverman-Anderson score calculation in that child. So video questions based are always asked, 1 or 2 questions from pediatrics, but there are not many in the paper. Now, what are the types of MCQs? Normally, AIIMS has almost 7 to 8 different varieties of MCQs in the exam. So the most common variety is the single best answer type, where you mark correctly and you get +1, incorrect answer -1/3. It is the most common type. Second, so almost 75%, 80% paper will be single best answer, the usual MCQs which you have been preparing for. Then multiple true false. Each question will have a stem followed by 5 statements, and each statement will be marked as either true or false. So multiple true false type. Correct answer, you will get +1/5 for each statement. Incorrect answer, -1/5. These are tricky questions and they are similar to PGI exam questions because PGI also has multiple correct options. Third type of question which is asked in AIIMS entrance, there will be match the column type. Column A will have 4 options, column B will have 5 to 6 options, and you need to match correctly. Correct for each correct alternative +1/4, for each incorrect alternative -1/4. They are relatively easy and scoring a bit of practice is needed. Remember that almost 80% paper will be of this variety. A few questions of this variety, 4, 5, 3, 4 questions of this variety, and you have of 3, 4 questions of sequential arrangement type where you need to put the question in correct order. Like question will have the correct answer will get +1, incorrect answer will get -1. So question they will give you the following are the causes of neonatal sepsis. They will have group B streptococcus, E. coli, Klebsiella, Pseudomonas, Neisseria meningitis, and they will ask in a newborn put in decreasing order with most common being first and least common being last, and there will be 4 options related to them. Correct order of frequency you will have to put. So sequential arrangement type, they need practice but they are usually very scoring. And multiple completion type, 2 to 3 questions are there of this variety. Each question will have 4 alternatives. Alternatives will be like this, like there will be 4 alternatives given, then option 1, 2, 3, 4, if ABC are correct, you will mark option 1, 1 out of these 4 options. If A and C are correct, option 2, you will mark option B and D are correct, you will mark option 3. And if all 4 are correct, you will mark option 4. But only a single correct out of these one should be marked. There will always be a single correct option. Examples of these, as I said, I will be taking up in the next video. I'm just giving a superficial bird's eye view. So correct answer plus 1 by 4, incorrect answer minus 1 by 4. And then you have the assertion reason type. In your NEET exam, NEET UG time, you have solved assertion reason type questions. These are the 5 options you will have. Assertion, reason, both are true, and reason is correct for A. Assertion, reason, both are true, but reason is not the correct explanation for A, and the other 3 options. Only one single option will be correct out of these 5. Correct answer again plus 1 by 4, incorrect answer minus 1 by 4. So if you see carefully, the negative marking is variable across different questions. In questions which have less negative marking, like these, you can take calculated risk, whereas questions where there is plus 1 minus 1 negative marking, you should be very careful and take only mark only when you know. And finally, the most difficult one. Not many 3 to 4 questions are of this variety, but they are tough. Now they will give a extended matching, they are known as extended matching question, and they are very time consuming as well. So always solve them once you have solved most of the paper, because many times the paper can be lengthy and you may fail to complete the paper on time. Each question will have a theme, a focus, a lead in question, and a scenario, and then you will be marked according to that. So correct answer will be number of scenarios divided by 1, incorrect answer minus number of scenario divided by 1. It sounds a bit intimidating. Let me give an example. Theme would be fever with rash. Focus, you will have a child with presenting with fever with rash. What will be the lead in question? Lead in question, they will say a 3-year-old child presented with fever and maculopapular erythematous rash starting on the body and spreading elsewhere. And the scenario. Now there will be 2 or 3 scenarios. First scenario, ये ऊपर का statement, this will be there. Then there will be options, 6, 7 options they will give. All the options will have fever with rash, measles, mumps, rubella, Kawasaki disease, Henoch-Schönlein purpura, drug rash. Essay, there will be 5 or 6 options. And then the question, actual question will begin. Part 1 of this question will be, if this child is also having strawberry tongue and fever lasting more than 7 days, not responding to antibiotic, what is the likely answer among the options given? So this is scenario 1. What will be your likely answer? Kawasaki disease. So you will mark, if Kawasaki disease is the C option mentioned above, you will mark C as the answer. Then part B of this question will be again a clinical vignette. If the child has no fever but history of intake of penicillin like drug, and there is a similar history of atopy in the child, and there is a positive tests for immune, there is a history of immune complex reaction, what is the likely diagnosis? You would think of drug rash being there in the child. So again, you would mark accordingly. And third scenario, if the rash started not on the trunk but inside on the face with prominent retroauricular and suboccipital lymphadenopathy, what would you think of? Then the answer will become rubella, and you will mark rubella in that question. Now, correct answer. How many scenarios are there? 3 scenarios. As I gave the example, there may be 1, there may be 2, there may be 3 scenarios. Depending upon how many scenarios are there and how many you mark correctly, you will get answer to that question. What it means is, suppose there are 2 scenarios in this question. Suppose there are 2 scenarios. You mark both of them correct, your answer is plus 2. If one scenario is correct, one is incorrect, plus 1 minus 1, score is 0. And suppose both of them go wrong, you end up with minus 2, which is a huge negative marking. So extended matching questions are difficult, they are time consuming, and you have a, yes, if you get them right, you can have a huge score, but if you get them wrong, you can have a bad score as well. So obviously they are the most tricky, and the system is also a bit confusing. Majority of these questions, they are purely clinical. Medicine, surgery, obs-gynae, peds, psychiatry and orthopedics are the areas from where they are asked. But again, integrated concept is there, integrated questions are asked. Some part will have medicine also, anatomy also, physiology also. So what it means is, in AIIMS exam, the time of you simply mugging up a guide, going into the exam and thinking, okay, I have done this guide, I will get selected, those days are gone now. AIIMS exam tests your knowledge, it tests your concepts, it tests whether you can relate one thing in one subject to another or not, and whether you know the reason for that thing or not. So that is why AIIMS exam, only the best cross it. So these are the 7 types of questions which are asked in AIIMS exam. What is the general weightage? Maximum MCQs, as like any other question paper, are asked from medicine, surgery, obs, gynae and pathology. Middle level weightage, pharmacology, anatomy, orthopedics, micro, my own subject, pediatrics, particularly neonatology, orthopedics, PSM, ophthalmology and physiology. Slightly less weightage is that of ENT, biochemistry, radiology, psychiatry, anesthesia and dermatology. And video and visuals are always asked in pediatrics. So if you are preparing pediatrics, always look at image-based questions and videos as much as possible. And many questions have integrated, that is overlapping across multiple subject. Example, they will give you a photograph of a worm and they would say, what is the mechanism of action of drug of choice of this worm? This is a typical example of an integrated question. It is checking whether you can identify the worm, so microbiology. Then you should know pharmacology, the drug of choice of that. And then deep pharmacology or medicine, what is the mechanism of action of that particular drug? So these are known as integrated questions. These cannot be prepared by sitting at home or simply mugging up the guides, sure success, this, that, all those guides which are available. You need to understand the whys and the concepts. So that is why AIIMS actually separates the grain from the chaff. It is the one which actually tests your knowledge. What happened in the last paper? Because AIIMS has a tendency to repeat the trend for a few years. Last November paper was hugely clinically oriented. 50% anatomy questions were visuals or clinical overlap. So it was not the direct asking most common artery supplying this structure. They were associated with clinical STEM. There was less PSM, although PSM is important for AIIMS usually, but there was less questions from PSM, less weightage of obs gynae than expected. More than expected questions were asked from dermatology, orthopedics and anesthesia. Together, dermat, ortho and anesthesia together taken had almost 20 to 25 questions from these 3 small subjects. If you look at the older paper, you may not even find 10 to 12 questions. So double the weightage was asked in these 3 subjects. 3 direct repeats were there in the previous 2 AIIMS paper. That is why I keep saying recent 2 to 3 papers are very important. Silverman Anderson video was a direct repeat in the paper. It was a solvable but lengthy paper. So this was the AIIMS exam. Moving over to the PGI exam. The PGI exam paper pattern is very different. It is an online exam, 250 questions with 5 options each. Total 1250 options to mark. Duration is 3 hours. Earlier the paper was OMR sheet based. Now it is an online paper. But it is a lengthy paper. Many people do not finish the paper on time. It is a more lengthy paper than AIIMS, NEET or JIPMER exam. So PGI speed is very important. Second thing which differentiates it from other exams is it is a multiple correct option. Question number 1 may have A as answer, B as answer, AB as answer, BCD as answer, all 5 as answer or none as answer. Because a single question can have no answer, it can have multiple correct options. So that is the beauty of this paper. Marking is done on the basis of what you marked. Because overall score is given by the formula x over a minus y upon b into 100. What it means is x is the number of correct options marked by you. A is the actual correct options in the paper. Y is incorrect options marked by you and B is the actual incorrect options in the answer key. What it means is that your positive score should be very high and you should avoid negative marking as much as possible. If you don't want to go into too many complex details, just mark only what you know avoiding any calculated risk. In AIIMS, you can take calculated risk. In PGI, any calculated risk should be avoided. Suppose you get a question has 5 options. You are sure about 2 options ki ye nahi hai. 2 options you are sure ki ye hain. 5th option you are shaky. You are not 100% sure. In any other exam, you would take risk and mark that 5th option taking undue risk. But in PGI exam, you will only mark those 2 options which you know are 100% correct. You will not take risk in the other options, because if your other option is incorrect, it will eat into this positive score and you will end up with huge negative marking. If you don't want to go into complex mathematics, remember approximate. Actual alag hota hai, but approximate PGI negative marking is -1/1 for anybody who attempts almost 75% of the paper. So padna pura hai, but every question you mark according to what you know. And PGI paper 10 to 12 questions, nobody can answer. It's okay, leave them unattempted. Marking a wrong answer will eat into your score, but if a question has suppose 3 correct answer and you mark only 1, you get credit for what you have marked. You don't get discredit for missing the other option. That is the beauty of PGI paper. In my third video, I'll be spending full 5 minutes on giving you example of MCQs so that it becomes very clear with you. And after generating the score, the topper score ke hisab se there is a percentile based list. So it is not a percentage score, it is the percentile based rank list which is generated. It is the highest negative marking among all exams. This is the weightage of the paper. As you can see here, radiology, let's go systematically. Obviously, medicine will have the highest questions, 36. Surgery will have highest weightage, 36. Followed by you have the usual ones like immunogenetics and molecular biology is 10, applied biochemistry is 12, so total biochemistry is approximately 22. Recent paper there were 3 to 4 questions less, so 17 to 18 questions were asked, but ek do upar niche hamesha chalta hai. What is important here is pathology also has significant weightage of 15 questions. Then comes your, and of course your obs gynae. As I keep saying, medicine, surgery, obs gynae maximum weightage hota hai, followed by pathology. And then look at the subjects: microbiology, which has 12, pediatrics, which has 12, radiodiagnosis, radiotherapy together they have 12, and pharmacology has 12 questions. And the other subjects, they have relatively less weightage as compared to these subjects. And one subject which is missing here, it is not mentioned. This photograph is taken from the last prospectus of PGI. Anesthesia also has 6 questions. It is not mentioned there. It was a mistake, which was it had been skipped even by the PGI people themselves. They also forgot anesthesia as a subject, but you must read it. 6 questions. They might be very easy. So this is the general weightage. Moving to what was the latest trend. In the November paper, the examiners almost stuck to the weightage, but there were a few less questions than expected in biochemistry, PSM and anatomy. Usually obs gynae has a lot of repeats, but there were less repeats in this paper, and predictable stuff was asked in pharmacology, pediatrics, medicine and radiology. Molecular biology and inborn errors of metabolism was tough. So anybody with good hold over biochemistry, good hold over your phenylketonureas and glycogen storage disease and their clinical aspects would have got through in PGI. In fact, one of the top 10 rankers who met me, he was like, sir, the best thing I did while preparing for PGI was to read biochemistry and to be good in inborn errors of metabolism. Again, IEM is an ocean, you cannot be master of it, but do it at least better than what others would be doing. Then 5 questions were asked on syndromes, 3 were expected, 2 were rare syndromes. No visuals were asked in PGI, although they can be asked in the future, and lengthy but solvable. So this was the PGI paper. Coming to JIPMER exam, the paper pattern. JIPMER, one disclaimer, it is the most unexpected paper you would find. It is the most unexpected. JIPMER वालों का कोई भरोसा नहीं है examiner का. They can put anything in the paper. Sometimes they make it so tough, पसीना छूट जाता है, even in winter season, and sometimes it's so easy, you are like, they will ask you question like, surfactant deficiency in a preterm newborn produces what condition, and option will have hyaline membrane disease. ऐसा question भी exam में आता है. And sometimes they will ask you the composition or the structure of SPB protein in surfactant. So JIPMER can go either way. Negative marking is -1/4. More questions are in there in clinical part than paraclinicals, but paraclinicals except pharmacology are usually easier as compared to clinical subjects. Less visuals are asked than AIIMS, usually 20 to 25. AIIMS, almost 50 questions can be visuals. No videos have been asked so far, but they can be asked in the paper. It is impossible to predict. It is usually tougher than AIIMS or NEET exam. Last 4 JIPMER, if you take them, 3 of them, even the topper could not score more than 50%. So in JIPMER, zaruri nahi hai you know everything. Even if you don't know 15-20 questions, it's fine. You should know a bit more than others and avoid negative marking. Rare genes, new drugs, rare syndromes, and fine details of inborn error of metabolism are usually asked. JIPMER people have a special affinity for physiology and genetics. So physiology, genetics part of pathology, syndromes, CNS, whether it is your physiology part, whether it is neurosurgery, whether it is medicine CNS, whether it is pediatric CNS, they are very important. Vasculitis is often asked. 3 to 4 questions are from vasculitis, and nephrology also, Bartter syndrome, Gittelman syndrome. Fine details of these are usually asked in JIPMER exam. What was the trend in last paper? It was relatively easier, solvable, but lengthy. PEDS had 2 to 3 questions more than normal, but it was fairly solvable. Less visuals were asked. Rare syndromes and genes were still asked. Obviously, you had to leave them. Less PSM and anatomy than expected. Medicine surgery was asked maximum, as we already know that medicine surgery obs-gynae हर paper में maximum आएगा. But the problem here is सब लोग medicine surgery obs-gynae अच्छा पढ़ के जाते हैं. So it is the B-level subjects which make a distinction. And this is why many people say get a good rank in NEET, but they just fail to reach the top 100 or 200 in central institutes, ending somewhere around 250, 300, 400. A lot of them ask me, sir, where did I go wrong? Yes, your medicine surgery obs-gynae is good. Keep them good. Keep revising them. But at the same time, the B-level subjects, microbiology, pharmacology, pediatrics, orthopedics, physiology, they are the areas where your strike rate needs to be more than what it is now. And takeaways, looking at these all trends, overall takeaways, all 3 exams are now more clinically oriented than before. Paraclinicals not to be neglected. होगा क्या? आप लोग paraclinical छोड़ेंगे, and examiners know this, and they will put more questions from paraclinicals, and those who are reading only clinical, they will be in a soup then. Pathology, pharmacology are universally high scoring. Medicine surgery obs-gynae maximum hota hai. AIIMS has maximum number of atypical video and clinical questions. Biochemistry, pediatrics, radio, ortho and microbiology need more attention than before. Physiology and genetics are important for JIPMER, and looking at recent trends, dermatology and anesthesia are now more important for AIIMS exam. And finally, ophthalmology में cornea and retina. AIIMS, PGI, JIPMER तीनों पेपर को अगर आप देखेंगे last 2 years के almost 1/3 ophthalmology was from these 2 chapters. So revise these 2 chapters properly. छोड़ना नहीं है कुछ भी, because whatever you leave, questions will be asked from those areas. But give up maybe 5% more weightage in ophthalmology to these areas as compared to others. So this is regarding the takeaways. And then part 3 of this video, I'll be giving you examples of the questions which I gave here. I'll be telling you how you make mistakes, why you make mistakes, and how you can avoid them. अब वो होगा कि नहीं, that is not in my hands. I'm just a coach. To play well is your thing. And integrated clinical MCQs, how to prepare, what do I mean by them, and what to expect. I'll be talking in the third part. Thank you very much. Keep preparing.